everyone, thanks for signing on. We are going to get started. Katie, I'm going to take over the screen share. Here, okay, I think we should be all set with my slides on the screen.
Looks good.
Okay, great, thanks. All right, good morning, everyone. Thanks again for joining. This is our Healthy Town application webinar today. If we have not had the chance to meet, I'm Julie DeSimone. I am the program officer for the Mayor's Wellness Campaign here at the New Jersey Healthcare Quality Institute. Before we get started, I just want to thank our 2022-2023 Mayor's Wellness Campaign sponsors. Without them, we really would not be able to do all this work and support the work that you're doing in your communities. If you are not familiar with our program, the Mayor's Wellness Campaign is a statewide community health initiative that is in partnership with the New Jersey League State and Municipalities. We provide mayors and community leaders with tools, strategies, and support to champion healthy and active living and to improve the overall health of your communities. The Mayor's Wellness Campaign gives mayors, your staff, and volunteers the platform and tools needed to make your communities a healthier place to live, work, and play, although I assume that most of you who are on this webinar are aware. So why would towns want to become a healthy town? We'll just start there. It's a really great opportunity for you to be recognized for all of the work that you're doing. We highlight communities in which mayors have made healthy lifestyles a top priority and are actively engaging all members of your community through inclusive, evidence-based health and wellness programming, policies, and also just an overall culture of health. The Healthy Town designations are a really important honor, and they're achieved through a competitive process annually. So that's just something, again, if you're new to the process, to note, this is an annual application. You have to apply each year to maintain your designation. It also challenges your Mayor's Wellness Campaign team to maintain or improve upon your designation from last year and strengthen your programs. And it helps you to utilize the designation to engage residents in the success of your program. It's a really nice way to have some materials and some nice press and things to push out to your residents so that they know about the activities that you're planning. The designations are not given to a set number of Mayor's Wellness Campaign towns, so we get that question a lot, but rather to towns who apply and meet the high standards that are defined in each year's Healthy Town rubric. So Mayor's Wellness Campaign towns can be recognized in 3 categories: Healthy Town, which is our gold designation; Healthy Town to Watch, which is our silver designation; and then Healthy Town Up and Coming, which is our bronze designation. So I'm just going to give you a little bit of information about what it means to be in each of these 3 categories. For our Healthy Town gold designation, these communities have well-established, engaged Mayor's Wellness Campaign committees that utilize research and local data, including social determinants of health, to assess the health of your communities. They collaborate with local partners to implement programming to reach health goals established for that year, successfully evaluate that programming, and have a sustainability plan in place. Healthy Towns to Watch are communities that are on their way to becoming that healthy town, have made a commitment to improving the health and wellness of your communities, and along with key stakeholders, they've started to incorporate local data into programming and have identified ways to evaluate their programs. And then for our Healthy Town Up and Coming, these communities have made the decision to focus on health and wellness in your community. You've started inviting important stakeholders to the table and offer healthy activity and education programming to residents. And we'll talk a little bit more about what each of those categories means when we look at the rubric. Okay, so all the applications this year will need to be received on our website by January 20th. At 5 p.m. And we will announce the winners in March, as we always do. We are going to actually walk through the application now, just as a way to give you some examples and see the types of information that we're looking for. Okay. I know that some of these are going to seem some of what I'm going to say is going to seem very basic and intuitive, but we do get questions about this, or sometimes are missing information that we're asking for. So that is part of, oh, let me just. Okay. Sorry, guys. Okay. So in the beginning of the application here, we're just looking for general demographic information. Please be sure to fill this out. I should say this at the beginning. If we're asking the question, it means that we're looking for that information. And we're also not looking for any information that we're not asking about. So just be sure to read the question, make sure that you're answering it completely, and don't feel the need to include any information that isn't being requested of you. We do ask for all of this contact information. I want to note here, we're putting official name here. Sometimes there's some discrepancies about how people refer to your town in shorthand, what your town's actual name is. And we want to be sure that we have the official name so we can put it on your banner. We can include it in the press releases and on the plaque. So make sure that you're being mindful of that when you're filling that piece of it out. Again, just some basic information here, contact information. Something new that we are asking for this year is your social media information. If your town does not use it, please type in NA, but if you do use it, please put your appropriate and correct tags there. Again, when we're highlighting your work or notifying people that you've received a designation, this is how we will do that via our social media platforms. Okay. In the first question, we're asking you to describe your community's demographics. So the census information has been updated for the last few years, especially during the pandemic. We did allow towns to just kind of reference the previous year's application. That's not an option this year because we know that there's new data out there available. So please be sure to fill this out. You will not receive points if you don't put information in here. In question 2, we are talking about we're looking for a demonstration that you've done research to determine your community's health needs and how your programming addresses those needs. So we're looking for evidence-based programming that supports your research. For example, if you reviewed in your local community health needs assessment, if you reviewed your local community needs assessment and discovered that your community has a high rate of residents with diabetes, then we would look for programming that addresses diabetes, such as chronic disease management classes, opportunities for physical health, or access to affordable, healthy foods. So, sometimes we have towns stating what their top health needs are, and then when we look at the programming that they've provided, there's not a correlation there. So that's something to just be mindful as you're planning your programs. The needs assessment really should drive that program. And we're looking for those connections in this application. We do provide in the rubric in our Mayor's Wellness Campaign Handbook a lot of suggestions on where you can find this data if it's not something that you've already done. So, if you need assistance with that, you can always reach out to us for help. In question 3, this is where this is a new question. There are some changes this year. So again, those of you who have applied in the past, make sure that you're taking a look at some of these new areas. It's not exactly the same as last year. In question 3, you're going to describe the results of that needs assessment that we just talked about. So based on that research, what have you determined are the top 3 areas of health and wellness that your community needs to focus on? This is just a way for us to really clarify and drive home that point that research process is not done just for fun. We really want you to be able to say, this is what we got out of it, and then move through the planning process based on that. And that's really what question 4 is going to help you to connect to. We're asking you to describe the goals of your programming. So for example, is the goal to provide physical activity opportunities, to provide health education to residents, to increase access to healthcare? So by setting these goals at the beginning of the year, you help to create more meaningful programs that are linked to the findings in your needs assessment. Sometimes your goal might be to offer 4 activities throughout the year or 1 program per month. Those are perfectly fine to include, but what we're really asking for here are what are the health and wellness goals that you're looking to achieve through your programming. In question 5, we're just asking you to talk about your Mayor's Wellness Campaign Committee. So successful committees are going to have a diverse group of stakeholders at the table that meet regularly to discuss programming. If you have your mayor, your public health officer, a school representative, local business owner, and an employee from your local health system that meet on a quarterly basis, that's you're going to be in really good shape for this question. If you don't have a formal committee, you can just note NA. It's just one section of the application. Again, sometimes people will include information here about other committees that run or other ways that they collaborate with stakeholders, which we're glad that you're engaging in those processes, but we're just looking for information about your Mayor's Wellness Campaign Committee in this question. And your Mayor's Wellness Campaign Committee might be combined with your municipal alliance, with your health department, your board of health, with your recreation department. We know it looks different in every community, but just make sure that you're focused on your Mayor's Wellness Campaign Committee for this question. This is another area where we have a little bit of a change to the format. This is where we're asking about your programs throughout the year. So to respond to this question, you're going to download this Excel sheet right here. I can click it and show you. I'm just not sure how it's going to pop up. So you'll download this form. And you're going to provide all of your program activity information through this Excel sheet and then upload it. I hope that this will be easier for you guys as applicants. We've had towns who have created this for themselves in the past, so I think that this is going to be a much easier way for you to include this information. It also helps us to really delineate which parts of the questions are being answered. This is the information that we're looking for. We're looking for program, the name of the program activity, the health goal of the program. So what area of health are you trying to address through the program? The social determinant of health that's addressed by the program, the target population, who are you expecting to come out to this program? Partner organizations, anybody that you worked with in your community to put on this event, the cost to participate, the attendance, and then how you evaluated the program, your evaluation method. For any of these categories, if it's not relevant, if you don't have a social determinant of health that's applied, if you didn't have a cost to participate, just indicate NA, don't just leave it blank, because that helps us to understand that you are acknowledging that part of the question. You're just letting us know that that was not relevant to the program that you are telling us about. When you download the form and save it, make sure that you're including your name of the town in the file, and then you're going to upload it right here, the same way that you would upload some of your other documents later in the application as you've done in the past. So again, this is meant to make it easier for you all, and we'll definitely be open to feedback after this round of application to see if that's something that was helpful. As a reminder, and this really goes for all of these questions, we are only asking you information about programming that happened during 2022. So that needs assessment process, those program plans, all of these activities, all of this should be taking place in 2022. When we're asking you what the goals of your program are, you're going to be thinking back to, this time last year, what goals did you set for the upcoming year? That's part of it being an annual designation. We're not interested in what you did in 2021 in the programs that you've run for the last 10 years. Most likely we've heard about those programs and we already know that those are great. We're looking to see how did you address health and wellness in your community during this calendar year. So just something to be mindful of during these activities. They should only be activities, programs, and initiatives that took place during 2022. In question 7, we're just asking you if you've utilized the Quality Institute tool. So the toolkit that we offer, the handbook, are multiple tools that we put out throughout the year. We have the mental health toolkit, we have the social isolation toolkit. We also, this is a good place to note if you saw an idea from another town in one of the Mayor's Wellness Campaign newsletters, and then you adopted that. This is a place to tell us were our resources that we've been putting out useful to you, and did you utilize them in your programming? Another thing that you can mention here, did you use the Mayor's Wellness Campaign handbook to start your program or to collect data for your needs assessment? So anything that we gave, that we provided to you, if you used it and it was helpful, this is where we want to know about that so that we can make sure that we're providing resources that are useful and meaningful for your programs. In question 8, we just want to learn strategies that were most effective for your community in outreach for your programming. One of the things that we heard this year in our focus groups is that attendance was a challenge, getting folks out to programming. So I'm not sure if this is still left over from the pandemic or what some of those issues are. But if you had a really successful year in promoting your programs, we want to hear about it so that we can share those with our other partners. We want to know if you are able to connect your program back to the statewide initiative with the Mayor's Wellness Campaign as well. So do you connect people back to our websites? Do you note when you're using our tools and resources? Are you using the Mayor's Wellness Campaign logo that we provide, even if you've altered that in any way? So just trying to understand how many programs are benefiting from linking back to the Quality Institute. In question 9, we're asking about funding. We know that this is a huge concern for programs across the state. We are asking this question so that we can help us to understand how we can best support your program and help us develop best practices from other towns to learn from. So again, we recognize that this looks different. There's no right or wrong answer in this question. We want to know, are you doing fully volunteer-based programs? Are you using staff time from your municipal employees? Are you charging a fee for residents to participate? Just give us some sense of what that looks like when you're thinking about funding for the program. Question 10, very straightforward. We're just looking for an approximate number of program participants in 2022. Okay, and it's really important to know whether your town's Mayor's Wellness Campaign programs are impacting your community. So in question 11, any evaluation efforts should be mentioned here. For example, you might be doing pre and post test surveys for all of your educational events. Make sure that you're mentioning not only that you're doing that, but what are the results of those surveys? In years past, we've had towns say, yep, we do a pre and post survey. Well, tell us a little bit more. That's the impactful part. We want to know how did those programs, what did you learn from the evaluation of that program? And we've also given you a space to attach any surveys or evaluation tools that you've utilized. A lot of times we do get towns answering this question by saying we evaluated it by the number of people who came. You can still include that information, but I will urge you to especially for next year in your program planning, to think a little bit deeper about how you can evaluate program effectiveness. Participation means you did a great job of marketing that event, of getting people interested, of picking a topic that's relevant to your residents. But we want to really know, did this program achieve the goal that we set out to achieve? And again, we're here to support you in that work. And there's a lot of resources in our on our website for this as well. And then in question 12, we're inviting you to share your plans for 2023. It's more important really now than ever to have achievable goals to set for the new year. And so making sure that you're thinking about that in a meaningful way. What areas of health and wellness do you plan to address? That can be your most basic goal planning. And we want to make sure that you are thinking about those things as we close out 2022. In question 13, we want to learn about any successful programs or initiatives that your Mayor's Wellness Campaign is engaged in that you would recommend to other towns. This is a great way for us to be able to share your successes and to suggest other programs to our towns. We have gotten a lot of feedback over the last few years that it would be helpful for us to provide a platform for you to collaborate more with your other towns throughout the state. And that is something that we're working on. But in the meantime, we do always throughout the year, not only through your healthy town application. But when you have a successful program, send us that information, send us photos. We'll include it in the newsletter. We'll push it out to towns when they're asking us for suggestions. We never want people to reinvent the wheel. So when you have something that goes really well, feel free to let us know about that so that we can share that with other towns. And then in question 14, we are asking feedback about what you'd like to see from the Quality Institute and from Mayor's Wellness Campaign staff to help your efforts to make your communities healthier. We put out a lot of resources throughout the year. Most of them, especially now in the last few years, have been based on your feedback. And so we want to continue to hear about how we can better support the work that you're doing at the local level. And here you'll have the option to attach up to 5 additional documents that you feel are going to supplement your application. We love to see your photos here. As you can see throughout the webinar, we like to share those to be able to highlight the work that you're doing. You can also, if you did a needs assessment survey, you can upload that here so that we can take a look. Again, we do have the option in question 11, where you can attach any surveys or evaluation tools. So those can be submitted here, but anything else that you think would be relevant for us to have, you can submit in this part of the question here. And so I'll take questions at the end, but that is the walkthrough of the application. I'll mention this again, but you'll notice this year, I think in previous years, there was the option to save. We have removed that because unfortunately have had a lot of towns who have lost their work. Even previously, we did not recommend saving it to the website. Our website is just not really set up to do that in a predictable way. And so our recommendation is to work on these questions in a Word document as you're going along and working through them. And then when you are completely finished, to come to this page and then just copy and paste them in and submit all in one time. So do not start this application until on the website until you are ready to completely submit. And make sure that you are noting when you're working on your Word document, there are word limits. So if you don't pay attention to these, when you go to copy and paste them in, it's going to cut off some of your responses. So make sure that you're being mindful of the questions that have word limits on there. Okay. Now we are just going to talk about briefly the rubric. I think you all hear me referencing this throughout the year, and I will continue to do so. This rubric, although we use it this time of year to evaluate these applications, to me, this is a really important and great planning tool for you to be using throughout the year. If you're using these categories and this is a checklist of what things do I want to accomplish throughout the year, then this time next year, when you're applying, all you have to do is kind of pull out your little checklist and say, okay, I know that I've done all of these things already, and it makes the application process a lot easier. You're not scrambling back to think about, what did we do in January? What was that program that we did in March? How many people came out to it? This is a really great way for you to set yourself up for success for the application each year. So these questions do correlate, the categories on the rubric correlate with the questions that we walk through. We use this rubric and we go through and just look at where you fall in these categories, and that's how we score the application. Towns we already talked about how there are 3 different designations. So it does say this up here. You can see what score you need to receive each of those designations. And it really is as straightforward as that. If you're getting those points in those categories, then that's the designation that you'll receive. I do want to note that one of the categories on the rubric is, did you sign a 2022 pledge of participation? So if your mayor has not updated your pledge, be sure to do that. If you're not sure if your town has updated your pledge or not, feel free to reach out to me. I can let you know, but that's a really easy way to get a couple of points. Okay. And just as another note, towns who apply in the previous year do get a bonus 2 points on your application. So you do benefit from applying each year. Okay. back to our spread. Okay. Here's just some highlights from last year. We have in the top left, we have a blood screening from Fort Lee. In the top right, we have a Franklin Lakes yoga photo. And then the bottom left, we have a cranberry hike. Again, share these photos with us. It's a great way for us to highlight your work and to show the benefits of your local programming. Here's a list of all of our designees from last year. So we love to see a big group in this category here. We hope that that will be inching you over into the Healthy Town to Watch for this year. And just want to give you a sense of the number of towns that are receiving these awards for last year. So some benefits that you'll have access to once you successfully receive your designation. All towns will receive a plaque and a banner to help share the accomplishments with residents and to encourage that culture of health in communities. We hear from those of you who are designated that those signs are really helpful, especially if you're putting them up around town hall. People are asking about them. What does that mean? What programs are offered? So again, it's just, we're trying to help you to support getting the word out about your program. Similarly, each year we publish a press release highlighting the winners. We'll provide you with some, we'll provide that press release to you so that you can push it out in your local press as well. And we also will highlight you in our newsletter, on our social media, and as well as in an article for the League of Municipalities magazine. And so again, this not only helps you to give credit to your staff and volunteers, but makes community members more aware of the programming that you're offering to increase engagement. So just a couple of important reminders. Use that Word document. It really, unfortunately, each year we have towns that say that they've lost their entire application after they've done the work. It's a really easy fix. Just create that Word document and be working off of that until you're ready to submit. And then when you do submit it, even if there's an issue with that submission, you have the Word document. There's no work lost there. Note those character limits. We get incomplete questions answered each year, unfortunately, and it's hard to evaluate when we don't have the full picture. And we want to make sure that we are using the information that you've deemed to be the most important to evaluate each section. Your responses should only address the 2022 programming. So when we're asking about a needs assessment, when we're asking about goal setting, it's goal setting that you did last January. It's that needs assessment that you did last year, and then programming that happened in 2022. For all of your file uploads, be sure to include your town name in those file uploads, even if it's a picture, flyers that have your town name. It makes it a lot easier for us on the back end of the website to know whose application goes with which supporting documents. So include your town name, and then also in that activities Excel sheet, make sure you're including your town name. And again, I know this seems like silly advice. Be sure that you're answering the questions. We really only need the information that we're asking for. The more concise and clear that your answers are, the easier it is for us to evaluate them. This is definitely a situation where less is more. I know sometimes we want to put as much information as we can to show all of the great work that we're doing, but make sure that the information that you're including answers the question, addresses what we're looking for, and that will really help your application to be clear and make it easy for us to evaluate. And again, the application deadline is January 20th at 5 p.m. That doesn't mean that you have to wait until January 20th to submit your application. Please feel free to submit those applications anytime between now and January 20th. Okay, and so now we will open for questions. You can type them into the chat or the question box. You can also raise your hand and Katie will unmute you, and then you can just ask a question as well.
Thank you.
Hey, Barb.
Hi, how are you?
Good, how are you?
Good. Can you send us links for the Word document the final application and the current rubric, and just email us those links, because I know there's different things on the website, and it would be great if we could just have those at our fingertips, if that's possible.
Yep. Yeah. So that'll be, we'll send it out as a response, as a follow-up to this webinar, but as we send out those reminders throughout the next month or so, all of those links will be included there as well. And we can send out the link to the Word document. The reason we haven't done that in the past, we can send the link to the Word document to make it easy for you to fill out. You still have to copy and paste all of those answers onto the website to submit. So just want to make that clear. You can't just upload the Word document. We do need you to submit it through the website. But yeah, Barb, that'll be in the follow-up email from today. And as you guys know, you'll see a few more reminders from me between now and January with those links.
Great, thank you.
Thanks, Barb. All right. Katie, do you want me to do Yasmin, go ahead. You can, I don't know if you're able to unmute or if Katie's going to do it for you. Yasmin, did you have a
Can
question
you hear me? Hello?
Yep.
Hi. So my question is, at the end of the application, when we submit the application, are we going to get an email confirming that this application was submitted correctly? Are we
Yeah,
going to
good
get
question.
a copy
So
of it after?
yeah, this is another, again, our website is not necessarily set up for these submissions in the best way. You should see on the screen, it'll say, thank you for your submission. Feel free to shoot me an email if you feel like you want that confirmation that we received it. It usually doesn't take more than 15 or 20 minutes to submit on the back end. So if you'll be more comfortable knowing that I have it, you're more than welcome to send me an email and I can confirm that I received it for you. But it should say across the screen, thank you for your submission for the 2022 application.
Okay, thank you.
Oh, I see Julia asked the same question. Yeah, you don't need to send me the Word document at all. The Word document is for your purposes to just work on that on the back end, and then you can submit it. You can submit the questions via the website. Mayor Kennedy website. I think it's up to you, Mayor Kennedy, as far as what you want to submit. I think it'll allow you to submit more than one website. Mayor Kennedy's asking about which links to provide for those social media areas. The other thing that you can do if you feel like your town has a lot of these and those spaces that we left on the application doesn't do it justice, you can include them in the question that asks about how did you promote your community, how did you promote your events to your community. You can always just include the extra links there if that's something that's useful to you. Okay, Matt, if your town has been recognized in the past, is the recognition level step by step, or can you jump to the top of the list for the highest category based on the points? That's a really good question, Matt. Yeah, it's not step by step. Like I mentioned earlier, I use that rubric. I go through, I use your questions to decide which category you belong in, and then I add up the numbers, and then I double check them because math is not my strongest subject, and whatever those numbers come out to is the designation that you get. So yes, if you were a bronze level, you can certainly skip right up to gold. That being said, if you were a silver last year, you can also be a bronze this year, and that's okay. We know that with competing priorities, things don't always we're not always able to maintain the level of programming that we did in the previous year. So I don't want people to be discouraged by that, and we know that we can support you to, regain that higher level of designation in the future. But yeah, there's no kind of rules about which category you have to go through to get there. It's just a matter of what you submit and what programming you did in the last year. 500 bonus points, Mayor Kennedy. I think we'll have to revisit that. I don't know who's putting out that those rumors. Let's see. You are able to submit video, Katie. I don't know if you'll know this off the top of your head, but do our limits on file size, is that going to be an issue there? Katie can get back to us.
Let me double check.
Okay.
I'll check right now what the limits are.
Great, thanks. Are we able to utilize an existing coalition to work on Mayor's Wellness Campaign initiatives? Yeah, that's a great question. You absolutely are. I think hopefully what I was saying earlier wasn't confusing. We allow and we also encourage towns to house their Mayor's Wellness Campaign committee under other areas that already exist, if that's something that makes sense for your town. So we do have towns that use their Board of Health and they have a standing agenda item about Mayor's Wellness. We have towns that use their green team in conjunction with their Mayor's Wellness Campaign program. We're perfectly fine with that. And again, it makes sense. We know that people have plenty of committee meetings to go to. You don't need to create a new one for this. What we've unfortunately seen in some of our responses in the past is towns don't have a Mayor's Wellness Campaign committee, but they go on to tell me about their great recreation department committee meeting that they had that really is not addressing Mayor's Wellness Campaign. So as long as throughout this year you've worked on Mayor's Wellness through that committee, it doesn't have to specifically be called your Mayor's Wellness Campaign committee, but it usually is pretty obvious if towns are really working on Mayor's Wellness in a meaningful way through these other committees, or if it's just something that they're trying to show that there's a committee that talks about programming. So that's all I was trying to communicate earlier. I hope that makes more sense. If we set a goal in 2021, yes, yeah. For 2022, is that acceptable? Absolutely. We would expect that you might be setting some of those goals in last year. I guess, again, what I was trying to point out is that as you're filling out your application, you can't set your goals for 2022 in December of 2022. So these would have had to be goals that you thought about previously, that shows some kind of thoughtfulness in those goals being addressed throughout the year, and that you then took that and planned your programming accordingly. So if in December of last year, you said, we really want to offer more outdoor opportunities for residents, and then your activities are all, you have 50% more outdoor activities for the year, then that's going to make a lot of sense to me. What won't make sense is if you offered all exercise classes and then you tell me that your goal was to offer more mental health services for your residents. So it's just, again, it does come through when things maybe didn't happen in that linear process. And there's nothing wrong with that. I don't want to, say that doesn't happen and that it's not a realistic way that programming works. It's just that when we're looking at these designations, we really are looking for that kind of top tier of programming, planning, implementation, and evaluation. It's like Katie's working on that answer for us with the videos.
Yeah, so I was just going to say that the maximum file size is 50 megabytes. So if it is larger, I would encourage maybe putting a link to the corresponding program on that Excel spreadsheet. I think that would be a good solution, but also a good question for us to add next year.
Yeah, good point, Katie. Thanks. And if you have trouble with anything, you guys know you can reach out to me. And if we need to, we can just have it submitted in another way. But I like the link idea. That helps us to kind of be able to look at it very cleanly as well. Same question for research. If we researched in 2021 and our 2022 program is in response, yeah, that's fine. Again, as long as if your process was for your 2022 programming, that makes sense to me. We would hope that some of those needs assessment or research processes happen before the year starts so that you can get started. Again, what really is not particularly relevant for this application is if you did a needs assessment last week, that information did not drive your programming for 2022. So I hope that makes sense. We're looking for, I'm not worried about, I'm not going to be checking dates on your calendar of when you did the research, but what we really want you to be able to show us is the information that you're using, did it drive this year's programming? Did the goals that you set, did it drive your 2022 programming? Did your top health needs that you identified through that process, were you able to utilize those to decide how you wanted to focus your programming for this year? If that's not clear, let me know. I think it's really what again, we've had people tell us about the needs assessment process that they're going to be doing for next year, which is great. We want you to be doing that. but it's just not going to be particularly relevant for this application. And also, that is okay. Again, remember that these are, each section is only worth a few points. It's not going to necessarily make or break your application if there's one area that you feel like you don't maybe have the strongest response. So don't get too hung up on one particular area if overall you feel like you have the information that you need to submit. Any other questions? Okay, just a couple. Those are all really good questions and helpful for us in how we are thinking about how we roll some of these things out. Okay, just wanted to remind you guys of a couple of activities coming up. Again, sign the pledge. In addition to, you still have a couple of weeks to sign your 2022 pledge. It's really easy points on this application. In addition to the points on the application, you also are entered into an incentive drawing, which gives you the opportunity to win $1,000 for your program, to run your local, to support your local programming. The statewide survey, which just went out, we launched it at the League of Municipalities, but we also sent it out via email over the last few weeks. This helps us to learn about your program locally, what you're doing, what's important to you, how we can better support you. It also gets you another entry into that incentive drawing. So it is a little bit of a longer survey. And so, it's not a quick 2-minute thing, but the information is really valuable to us and it helps us to drive our programming. And so we'll be sending that out for over the next month before the end of the year. So if you have someone in your team who can fill that out, we would really appreciate that. And then we do have mental health first aid trainings. Hopefully many of you have attended them. If you have not, please keep a lookout for these. The next one, the registration will be going out next week. And if you've already attended, make sure to share it with somebody in your community. These are free trainings that help you or help the participants learn how to support somebody who's experiencing a mental health crisis, and also talks about stigma. We have adult trainings for people who are working with primarily adults, and then we have youth trainings for people who are working primarily with youth. So the January and April will be adult, and then March and May are going to be youth. So keep an eye out for those. It's a really valuable resource that we're happy to be able to offer for free. So please take advantage of those. And that's all. So thank you all for joining us today. Don't forget to submit your application no later than January 20th. Again, don't feel the need to wait until that last minute. We're always happy to get some of those in early. Reach out to us if you have any questions or concerns. If you have issues submitting your application, just let me know. And thank you guys for all of the work that you do.